Our next speaker will be presenting the top socioeconomic abstract correlation between Ganey scores and quality outcomes from the N2QOD for a hospital-employed neurosurgical practice, presented by William C. Olivero.
Good morning. So I'm sure most of the audience is familiar with Ganey. Basically, they were amongst the first to champion this concept that patients should be viewed as customers. They're a company that measures patient satisfaction with the underlying assumption that patient satisfaction is a good surrogate for quality. Their mission statement is as follows. Coming from a company that basically sends out patient satisfaction questionnaires, I'm not exactly sure what that means, but they've been tremendously successful and very profitable. People are probably also very familiar with N2QOD, now called QOD. It's a registry developed by Neurosurgery to establish risk-adjusted national benchmarks for both the cost and quality of common neurosurgical procedures. Our hospital began participating a little over 3 years ago. So Carle Foundation Hospital is a 400-bed hospital in East Central Illinois. It's a level 1 trauma center, and it employs 400 physicians. During the year of the study, we had 5 neurosurgeons, and 4 there was enough data to do analysis on. So over the years, there's been a variety of criticisms of Ganey statistics, some of which I've listed here. But probably a even more important concern is answering the question is, are Ganey scores actually a good surrogate for quality? We asked the specific question, does patient satisfaction as measured by Ganey correlate with quality outcomes from N2QOD in a neurosurgical spine clinic? So during the year of the study, we did 450 lumbar spine surgeries. As you can see, the population in East Central Illinois compared to the national average in the N2QOD database is poor, not as healthy, and not as happy. And the overall results, these are the metrics where we fell below the national average. So this bottom metric, 1 and 2, the patient views the surgery as being successful, and 3 and 4 as being unsuccessful. Given the patient demographics, our overall results were not too dissimilar from the national average. However, the range amongst the neurosurgeons was quite broad in both the Ganey scores and the N2QOD. As you can see, the surgeon with the lowest Ganey had the highest N2QOD and vice versa. The surgeon with the lowest Ganey also had the shortest length of stay and the lowest morbidity. We found a negative correlation between Ganey scores and patient satisfaction with their lumbar surgery. This is the graph. We also found a slight negative correlation between Ganey and lack of complications. We found a slight negative correlation between Ganey and shortened length of stay. Although it would seem logical that there would have been extensive literature on the correlation of patient satisfaction and patient outcomes before this concept was so widely adopted, that has not been the case. Time does not permit me to go into great detail into the literature, but suffice it to say there have been some positive studies, but many more negative studies or studies that demonstrate correlation with things other than quality. And probably the study that's most germane to this talk is from the University of Utah. They found that a recommendation against spine surgery correlated with poorer Ganey outcomes or scores. And probably one of the most important publications on patient satisfaction was from the Archives of Internal Medicine. They found that higher patient satisfaction was associated with lower emergency department use, but higher inpatient use, higher overall health care and drug costs, and increased mortality. So one can envision the hospital CMO talking to the young gentleman down in marketing who's in charge of patient satisfaction. He says, "This study is troublesome. It seems like a satisfied patient is a dead patient." The young gentleman thinks for a second, light bulb goes off. He says, probably better to think of it as a dead patient is a satisfied patient. So in summary, we found a negative correlation between Press-Ganey scores and outcomes as measured by N2QOD. Given this finding and the results of the literature, it seems that the use of Press-Ganey scores, that is patient satisfaction, as a surrogate for quality needs to be reassessed. Thank you for your attention.